Thank you, Joy, for the introduction. Welcome to the session with Professor Oranee, Director of Siriraj Neuromuscular Disease, or SiMND. We are very honored to have Professor Oranee with us today, and we'll be sharing valuable insight into the journey, achievement, and have the future steps for impactful initiative of APPIS Innovator Program, Neuromuscular-Get-Trophy. So, Professor Oranee, would you be able to share with us on the gap and the challenges in terms of Thailand, in terms of SMA, and how the program is designed to bridge that gap?
With the current situation in Thailand, we have been able to reimbursement for diagnosis for spinal muscular atrophy or SMA. However, this reimbursement does not cover treatment and newborn screening, which are very crucial for preventing the incidence of SMA in Thailand. So this program aims to establish patient advocacy groups that can contribute to policy shaping and advocate for access to early diagnosis and treatment for SMA in Thailand.
Thank you, Dr. Oranee. So now that we understand the objective of the program, I would like to ask you a little bit in terms of the key milestone that you have achieved recently.
So we have designed 4 phases of program: connect, empower, frame, and change. Since we lack a strong group of patient advocates, establishing, connecting, and gaining insight from patients is essential. This serves as the foundation of program and is an ongoing process to accommodate new patients and caregivers seeking knowledge and support. We have conducted patient workshops to identify their needs and priorities. One of our significant achievements is the involvement of patient advocates from 16 houses. Additionally, we invite experts from Australia, Julie, and India, Aparna, to inspire and guide our patient advocates. Both have provided insights and overview on how patients in Thailand can work on building the advocacy.
Thank you, Dr. Oranee. I think this is very impressive progress, and I love how you designed the program into 4 phases: connect, empower, frame, and change. And I can also see that you have already started connecting and empowering patients with different meetings. So that's really great. Now, come to the next question. In terms of working with the project, I would like to ask if you and your team has encountered any challenges along the way, and how have you addressed them?
Yes, so we encounter challenge along the way. Engaging SMA patient and caregiver in advocacy activity due to their caregiving responsibility and lack of support. To address the problems, we provide options for patient and caregiver to bring their children to the event. To facilitate the process, we provide healthcare professionals and multidisciplinary teams to take care of their children while their parents can attend the workshop and events. The outcome was great. We increased the engagement of and participation of SMA advocacy in the community. So at the same time, children can able to socialize and interact with others by addressing their challenge and changing societal attitudes. We can create a more inclusive and supportive environment for SMA patients, caregivers, and their families.
That's a very thoughtful approach, and how you actually try to gain insight from patient, from caregiver, for better quality of SMA community in Thailand. Now, I've heard about the progress, the step that you have been working with the team. What are the next steps in terms of advancing SMA patient advocates and driving policy, and also in terms of this program?
So after empowering patient advocates, the next step is to help them frame their needs and create the change. Patient advocates can draft proposals, identify unmet needs, and develop programs to address those needs. We can collaborating with them to create activity and platforms that allow them to connect with policymakers and decision makers. Exhibitions and other events can provide opportunity for patient advocates to raise their awareness and advocate for change. By creating voice for SMA community, we can gradually bring about positive change of SMA in Thailand.
Wow, that's really impressive as well, and how you actually try to unfold unmet needs. And it's really important how you're trying to build patient advocate as a group and walk together and drive the changes. And I can see that you always talk about connect and empowering, and that's something very important to move forwards. So last but not least, Professor Oranee, I would like to ask in terms of what keeps you excited about SMA initiative and also this APPIS Innovator Program?
Thank you for the question, and thank you for the APPIS Innovator Program. As the physician, I am dedicated to improving the quality of life of the SMA patient through the early diagnosis and treatment and the newborn screening. It is also important for parents to have access to newborn screening to prevent their children from developing SMA. When I engage with the patient, they often express their desire to be viewed as a normal individual by society. They may not be able to walk, but they are capable of doing everything else just like others. By providing them access to treatment and improving their quality of life, we can also boost their self-esteem and make them happier. My team and I were excited to participate in this program because it aligned with our idea and goal for SMA patients. Without this program, it might have taken us at least another 5 years to establish an SMA patient advocacy group in Thailand. This program definitely has accelerated our program in this regard, which is crucial for driving policy change. I also believe that Thailand can share the best practice with another country and expand the program to other regions. This is my next goal. By doing so, we can create positive impact on the lives of SMA patients in Thailand and in our region.
This is very great to hear and very touching how you're moving forwards with the program. So if anyone here who have any questions, please feel free to contact Dr. Oranee and the team with the email shown in the slides. And on this note, I would like to thank Professor Oranee for sharing the valuable insights. We really appreciate your dedication to make a difference in SMA patients in Thailand. So thank you so much, Professor Oranee. And it's time to introduce you all to the next session, which is a session to share experience from APPIS Innovator Program from South Africa. So please welcome Gretchen from Cancer Association of South Africa and also Mandy from Novartis, South Africa. Thank you.